Major funding for today's broadcast is brought to you by RxCo. Vita Media Corporation presents In the Medicine Cabinet on the Pharmacy News Network. Welcome and thank you for joining me in the Medicine Cabinet, a production of the Pharmacy News Network. I'm Dr. Linda Bernstein, your host. Today my expert cabinet member is Lorie Rice, Associate Dean of External Affairs at the School of Pharmacy, University of California, San Francisco. Lorie is an expert on pharmacy ethics, and that's the topic of today's podcast. And now here's In the Medicine Cabinet. What has been the historical evolution of pharmacy ethics for the profession?
I think I'd like to begin by just reminding everyone that pharmacists have always been viewed as the most or one of the most trusted of professionals. However, it's only been fairly recently that pharmacists have been called upon to be a very, very active and very visible member of the healthcare team. And with that new involvement, pharmacists are being asked to participate in healthcare decision-making more than ever. And some decisions are pretty clear-cut, and some of them are going to require ethical consideration, and that is the challenge for pharmacists today.
So what are some of the biggest issues that are facing the pharmacy profession in terms of pharmacy ethics?
Probably the most prominent at this point is how our pharmacists are going to respond to issues dealing with reproductive rights. And certainly as we baby boomers continue to age, pharmacists are going to be involved more than ever with end-of-life care decisions. How do we deal with the aging population? And then continuously, pharmacists are going to be called upon to make decisions in terms of access to care and issues regarding who gets what drug, when, and who is going to pay for them.
Have these ethical issues triggered recent changes in policy or legislative decisions?
Well, certainly these issues, especially the reproductive rights, has really spilled over into the legislative arena. And while pharmacists and consumers and physicians got involved in the debate of who makes the final decision of who gets what drug, the legislature has trumped the consumer and healthcare professionals by making decisions regarding conscience. And that's what we see now on the state level and the federal level.
We'll be delving into that a little bit more later in the program. From your perspective, since you are deeply involved at UCSF School of Pharmacy, what has been the direction that schools of pharmacy have been taking in terms of training our pharmacists of the future in this area?
Well, I think more and more schools of pharmacy and medical schools as well, nursing schools, have really had to get in the business of training the practitioners in ethical decision making. Most medical centers do have ethics teams that work and help to make decisions. And what we want to do is to train our pharmacists not necessarily in what is the right decision, but how to go about making those decisions. You know, what is it? What is the context? What is the method for making those decisions?
That's really the basis of all of pharmacy education, is learning how to find the answer, learning how to make the decisions, and not necessarily having all the right answers at your fingertips, because sometimes there is no right or wrong answer.
Correct. And I think that's a struggle for pharmacy students and for some pharmacists, that pursuit of the absolute bottom line. What is the right answer? What is the most appropriate thing to do?
Pharmacists' refusal to fill prescriptions for birth control pills or RU486 or the morning after pill, that's an area that's come into the news quite a bit lately and has prompted chain pharmacies to come up with policies on how to deal with this. What's been your experience in some of the legislative areas and how that's been impacted?
Well, that's very interesting, because in this particular ethical situation, we really had two schools of thought from pharmacists themselves. Some pharmacists believing that when an individual comes into a pharmacy with a legitimate prescription It was the pharmacist's responsibility to fill that prescription. Other pharmacists, while perhaps being very sympathetic to issues around reproductive rights, were saying that no one has the right to tell a pharmacist when he or she should dispense medication. And so at the beginning of this discussion, what I was mentioning to you is the legislature has really made that decision for the profession. And the legislature has taken a Solomon-like position by really, I think, trying to come up with something that will work for everyone. Not everyone is happy with it. And the legislature has now ruled in California that when someone comes in with a legitimate prescription, unless the pharmacist has professional reason not to fill it, that it's either an inappropriate prescription, the wrong dose, whatever, so there could be a better medication, that pharmacist really has an obligation to fill. And there are a few caveats. One of them is if the pharmacist does not carry that drug, in which case the legislature said that the pharmacist has a responsibility to find a pharmacy and a pharmacist that does carry that drug.
That's an easier one to handle.
That's an easier one. However, there's also the conscience clause now in California, which says that if a pharmacist has moral or ethical reasons against filling a particular drug, they can decline to fill. However, the law requires that pharmacy have a backup plan so that the consumer does leave either with that drug or is referred to another pharmacy that will fill it.
Will that kind of a policy apply to other kind of medications as well?
This law in California did not specify that it dealt with drugs dealing with reproduction. It just was very generic in talking about a legitimate prescription.
We'll be back in the medicine cabinet in a moment. But first, here's a message from one of our valued charter sponsors. Another issue that certainly has come into the news in the past several years is the issue of privacy and the difficulty of maintaining that in a pharmacy environment.
Privacy is certainly an issue. We want to make sure that any conversation between the pharmacist and the patient is respected and is conducted as privately as possible. Of course, some of the times it's very difficult, as you said, in crowded pharmacies. There are other privacy issues regarding records. Who is entitled to records? Certainly other healthcare professionals can share them, but an example that I might give is if I went into a pharmacy and said, Dr. Bernstein asked me to pick up her medication for her, or Dr. Bernstein's family is doing their income taxes right now and they need the complete medication records and I'd like to pick them up. It's hard to know some of the time who is really entitled to that, and pharmacists have to be very vigilant about protecting the privacy of their consumers.
One issue that's bothered me for a long time is pharmacists selling products that may not be completely safe or effective. And that is definitely a problem because whereas prescription and over-the-counter products have FDA approval and they're supposedly safe and effective when taken appropriately, there are a whole slew of other medications such as the dietary supplements or even taking to another extreme, cigarettes that are sold in that environment. So how do pharmacists justify kind of the business decision versus the ethical decision there?
Well, certainly with cigarettes, I think that is really a very serious area that pharmacists and pharmacy corporations need to deal with. It seems very duplicitous in some way that going into a pharmacy where you're supposed to receive health care is also selling probably one of the most dangerous drugs. So I think we still have a long way to go in that discussion. The other issue that you raised, I'm going to turn the table on this for you, and I'd like to suppose that I'm a consumer and I walk up to talk to you as a pharmacist with a dietary supplement that you do not believe is going to be efficacious. And I say to you, I've been having horrible, horrible allergies my whole life, and I believe that this particular product is going to give me relief. I'm convinced of this. Everyone takes it, and it's great. And I really don't ask you for your opinion. Are you going to give me your opinion? Are you going to kind of poke the bubble of the placebo effect for me?
I think I will, actually, Lorie. I think that it's my professional responsibility to inform you about the pros and cons of your decision. Maybe that's going to mean I don't get a sale. And should I be even carrying that product to begin with if I don't believe in it? So it's really a tough decision, especially in the business environment.
Well, I appreciate your candor on this, and I can just tell you that probably when pharmacists do share the information that they have, their expertise, it really engenders greater trust for their patients.
There are a lot of ethical issues that are going to be facing us in the future, and one that comes to mind, especially after having worked for several years in bioterrorism preparedness, is the whole issue of having adequate vaccines or antivirals in the case of a pandemic. What are some of your thoughts about that, and what are the crux of those issues that we're going to be facing as pharmacists in the future?
Well, the issue while you're talking about pandemics is this is not going to be really a new issue. It has to do with societal prioritization. It has to do with access, and it has to do with scarcity of resources. And as I said, we've dealt with that in the past. I think pharmacists are going to be called upon, will certainly be players at the table if and when we have to make this decision about scarcity of medications. I think we're going to have to decide who is the most needy. It's not necessarily going to be first come, first serve, or who can afford it and who can't. I think the organ donation is really going to be a good model for us. But we're going to have to decide, with limited resources, how can we use them best?
And so these issues will continue, and we're going to have to continue to think as a profession how we're going to deal with them.
Absolutely.
And I think it's important that the conversation is now on the table, and some of these issues that perhaps before were shoved to the back are now coming to the forefront, and it's important for all of us to have a dialogue about these things.
I agree. And now more than ever, I think that the pharmacist's voice is going to be heard in the ethical decision making.
I'd like to thank Lorie Rice, Associate Dean at UCSF School of Pharmacy, for sharing her thoughts and expertise on pharmacy ethics issues. For more information, log on to www.pharmacynewsnetwork.com. For Pharmacy News Network, I'm Dr. Linda Bernstein. Until next time, when I'll be seeing you in the Medicine Cabinet. Pharmacy News Network is a production of Vita Media Corporation. Major funding for today's broadcast was brought to you by RxCo.